are also very fascinated by the new Department of Complementary and Alternative Medicine at the medical school, and we know that you've worked hard to put that in place, Dr. Mack. I mean, I am amazed that all of a sudden medical students are learning about this. Was this? Was this
so
anything?
You all didn't learn it in medical school?
I'll tell you. This was my teacher, right?
I mean, this was
Dr. Layne was my teacher. So when I first heard about alternative medicine and complementary medicine, when I was doing my rotations and I went through Dr. Layne, and that brought a whole different aspect, because in medical school you're looking at disease treatment, and then we treat once you have the disease.
Right.
Well, how about not going there?
Right.
And forget about being treated for the disease.
Right, and of course we're not saying that it's not important to learn disease and treatment. Those are extremely important. But this area of preventive health has been neglected for so long. It is really refreshing to see it coming back. Tell us a little bit about your program at the medical school and what you're doing.
The National Center for Complementary and Alternative Medicine is a newly established institute at NIH, the National Institutes of Health. They're saying that there's all this complementary medicine approaches out there. We need to categorize and we need to research them. For instance, I've been working with traditional healers in Senegal. We've got herbs from the healers in Senegal that they say will kill the HIV-1 virus. We brought the herbs back to our microbiology lab. We exposed the herbs to the virus. Each one of the herbs, 5 herbs, killed the virus.
Wow.
So now we're looking at time dose response, how long it takes, how much herb it takes, and then whether it's killing the virus inside the cell or outside the cell. So we can develop, for instance, an herbal microbicide rather than a chemical microbicide that would be more conducive for women to use. So these are the kinds of things that we can do, but also the physicians need to know now about these other approaches to health because the patients are doing it. And if you don't know what they're doing, then looking at the synergy between these different modalities could be missed, and there could be some contraindications.
Right, and I want to make it very clear that we are not saying that all the scientific research that we've done in the last half a century has not been useful. It's been very useful. But Dr. Mack has often heard me say that if our parents and our grandparents were stupid, we wouldn't be here.
Right.
So I think really what we've finally come around to learn, I think, is that you're better off when you take the best of both worlds and put them together. It's not that scientific medicine is bad, it's very good, it's taught us a lot of stuff. But our grandparents were using herbal remedies and so on that worked for centuries, and we can't just throw them out the window. It's sort of stupid to do that. So what we want to do is take the best of both worlds, and we're finally
put it together. And use to prevent the disease, because you love your son, newly born, but you want to keep him from getting a cold. So you're going to put a coat on him before he goes outside. Preventive medicine is putting that coat on.
Fantastic.
You know, just waiting for the cold to happen is not the way to go anymore.